Okay, ladies and gentlemen, we are officially live. This is Legacy Dialogues. For those of you who joined me before, you understand that this is a platform where I bring you professionals from across the globe, individuals that are doing things in various different areas in life. And I like to put individuals in front of you who are being successful in various different areas to show you that when you take in certain information and surround yourself with certain types of individuals, you too can get to the places in life to where you start to create the legacy that you desire to leave. Now, the gentlemen that I'm going to bring before you today are actually out of the state of Texas. I met one of these gentlemen probably quite a while ago now. And then he was able to introduce me to the other. And just the work that they do was such beautiful work, specifically as it pertains to the individuals that I'm connected with. My academic background being in the psychology and social work space and the types of clientele that I've worked with in the past. I wanted to be able to bring them to you. And this likely won't be the last time. So without further ado, I'm going to go ahead and bring these guys forward. Andrew and Anton, how's it going today?
I'm good. How are
Fantastic
you?
today. Thank you.
Wonderful, wonderful. For first off, thank you guys for making the time to be with me today and be with our audience. Uh, we'll kind of start off just your typical manner, and when it comes to any type of live or podcast format like this, if you guys don't mind, just kind of give a quick little synopsis on who you are and what it is that you specifically do when it comes to the organization that you guys work with. We'll give the mic to Anton first.
Yeah. Hey, everybody. Thanks for joining. So, entrepreneur, lifelong bartender, father of three. Entrepreneur. Really love to network and connect with people. Been able to, work home for a long time. Able to get into the whole business funding world. Been involved in a bunch of different industries, but Texas Care is kind of my home now. I'm able to connect with Andrew and hear his vision for Texas Care. And I've kind of planted a flag there with Andrew, and it has been amazing. I really enjoyed it, and Andrew will kind of tell you the story.
Beautiful, beautiful. So Andrew, go ahead and kind of give us a little synopsis on yourself, who Texas Care is, or what Texas Care is, and like why you decided to involve yourself with and start to take this specific organization off the ground.
For sure. So, my name is Andrew Hsueh. I'm the CEO of Texas Care. So, I started off in this journey because the founders of Texas Care and I, we actually go way back. We've known each other for about 8 years now. And, we hit it off immediately when we met. And, full disclosure, I started off with Texas Care first as an investor. And as we started to progress on the work that Texas Care is doing, especially in the communities that we serve on the lower income side, a lot of the stories just really, really touch my heart. Like I mentioned before, I have two little girls of my own, and a lot of the stories really that impact my heart. We found out. We found out that most of the kids that wind up cutting themselves or doing a lot of self harm is due to sexual trauma. And
Hmm.
we are based here in Houston, and one of the things that is no secret is that Houston is a major, if not one of the biggest hubs for human trafficking in the world. So, one of the things that we want to do is not only do we want to help, but, getting on platforms like this, we do want to address and bring awareness to mental health and then all of the things that are going on in this world. We are very, very fortunate due to our financial situation that our families are kind of in a protective bubble, so to speak. But one of the things that we want to let our audiences know that outside of this bubble, the world's a very, very cruel place, right? And being able to have resources to help these individuals in these type of communities, that is our passion, right? At the end of the day, addressing mental health awareness. Unfortunately, especially with the youth nowadays, with the rise of social media, with the rise of single parent families, with the rise of things that didn't even exist when we were kids, like cyberbullying. You know what I mean? Unfortunately, the mental health aspect of things, and all of the graphs, like self harm, teenage pregnancies, teenage suicides. Unfortunately, it seems like all of the graphs are trending very aggressively in the wrong direction. And we, as an organization, we are trying to identify the issues, and then we're trying to do our best to tackle those issues. So, thank you so much for having us on the platform.
Got it. Thank you, thank you, thank you. So, I'm listening to some of the things that you share, Andrew, as it pertains to the needs out there, as it
Mhm.
pertains to some of those families that may not, have the resources, the finances necessary to kind of build a hedge around their youth when it
Right.
comes to the world that we live in today. I mean, we
Mhm.
can go all the way from the political arena all the way down to just those children that didn't have great home training, and there's a lot of evil out there.
Mhm.
Now, I know, being in the helping profession, coming from psychology, studying social work, I found that it was very heavy female dominated space.
Sure.
Now, as a male, and I can kind of give my own reflection to this question as well, but I would like you to initially, what was that initial deep seated, I guess you would say, situation, or was there a specific thing that said, you know what, I have got to get into this space outside of having the finances to be able to do so? But what was that something that said, you know what, there's all these different things that I can focus on out here in the world as an entrepreneur,
Mhm.
but I want to do something that really makes a difference. I want to be that compassionate individual that
Sure.
involves myself in this space that's really going to make a difference. As a male, like, what was that trigger point for you to say, I want to involve myself in this space?
Well, Brian, one of the things I do want to disclose is that I am not on the clinical side of things, right? We leave that to the individuals that are way smarter than I am, especially when dealing with trauma, dealing with mental health issues, and dealing with children, right? So, what I bring to the picture is that, long story short, whenever I became an investor, the stories that touched my heart, that is when I went back to the founders of Texas Care and I said, hey, if we were able to combine, your decades of experience in this field now, they've been doing this since Columbine. I remember Columbine because I was in high school in Columbine. And, I'm not in my 20s. So between the two of them, they have over 4 decades of experience in this field. And, if we're able to combine all that experience with all of the infrastructure and all the experience they have, building up very, very successful mental health clinics, and then also, their ability to navigate through government funding, and, because that's very, very tricky. The funding is there. It's not hard to get money out of the government. You just got to know how to ask. And,
Excellent.
unfortunately, for the vast majority of people, they just don't know how to ask. So, where I come to place and where I actually, I believe I bring the most amount of value is when we combine all of that infrastructure that they already built with the decades of experience, and you combine that with our brand building and our business development and our ability to raise capital. That's when, we were allowed to give them the tools to basically do what they do best. And, in a way, I truly believe, yes, in this field, in social work, in psychology, yes, women do kind of dominate this field. However, I think, that is one of the things that we're trying to change, one QMHP and one licensed professional counselor at a time. You'll be actually surprised. We actually have quite a few, male QMHP, qualified mental health professionals in
Mhm.
LPCs that work for us. At the end of the day, it's more about qualifications and it's not about, race or color. When we see somebody that's very, very qualified on the work that they do, it's based on merit.
Wonderful, wonderful. Great, great, great answers. And one of the things you're mentioning, what you bring to the table versus what a lot of those other professionals bring to the table, and really marrying the two. and
Mhm.
that being what makes Texas Care what it is. So same question for you, Anton, and then I'll kind of give my reflection on it.
Yeah, kind of what brought me to this is obviously I have three little girls, and you hear stories that are on the news, or you hear a lot of different stories that are out there. For me, I'm just obviously an investor and a franchise owner. But having those young children and seeing what's happening, it really breaks your heart a lot of times to see what people are going through in the lower, in the different areas of the world, and especially Texas is one of the worst. I believe that Texas is in like 98% crisis mode as far as, and what I mean by that is it takes anywhere from 6 to 18 months for any child to get an assessment right now. And I think that's one of the biggest things that Texas Care is trying to do is trying to shorten that gap for when somebody needs help, to the point where they can get an assessment, they can get a treatment plan, and then the QMHPs can actually do the work that they do best and help these kids in a way that nobody else can. The difference between what Texas Care is doing compared to a lot of other organizations is the codes that we use, the medical codes that we use. They are codes that the QMHPs can actually go into the community, into the families' houses, into the schools. They can go to the kids, which makes it a big difference, because a lot of times when you're bringing a child into an office, it's not in a great setting to get them to open up as much as they normally would when somebody is actually in their environment. And I think that's one of the reasons why mental health these days is such an issue, is there's many private insurance companies that just don't take Medicaid. I mean? So, I mean, a lot of these private insurance companies, they have to pass them on to somebody, and it might be a nonprofit, it might be a government agency. As good of a job as they do, you need to have this type of company with Texas Care that can scale and get big enough where, as a school might have, 100 kids or 200 or 300 kids that really need the help. Instead of kind of going to, one to 30 or 40, 50 different, clinics to get these people help, we want to make it so that Texas Care is the only number they call, the number they think of when they think of these kids. And so I think that's one of the reasons. But as far as me getting into this, I mean, I just, I have fortunately enough to met Andrew, and I'm blessed to have known him, because he's been not only a great leader for Texas Care, but also a mentor to me. I've learned a ton from him. Charlie and Arian and the whole team at Texas Care is absolutely amazing. Just a great organization to be a part of, and I'm blessed to be a part of it.
Wonderful, wonderful. Great feedback. So two different areas I'm going to speak on, and then I have another question for you guys. So, what I heard from each of you, one was you wanted to be able to make a difference in something based off of personal situation, based off of the fact that you have children, based off of the fact that you're seeing problems that need reconciling, and you saw there's professionals in this space that are doing what they do at a proficient level, but there's not really systems in place to allow them to work at the capacity that they
Well,
could
Brian,
work.
I mean, I would say this, the government-run facilities and the nonprofits, they're doing a fantastic job, right? Unfortunately, most of the time, they're just simply overrun. The demand is way larger than the supply of help. So this is where, what we want to do as Texas Care as a company is to create that brand and create that uniform type of quality that you could depend on whenever you do see a brand. Because at the end of the day, when we speak with large organizations like school districts, school districts and large organizations that have a lot of these kids in need, they really don't have time to vet 30 clinics. What they want to do is work with one organization that has a track record of delivering a type of service that is uniform across the board. And that's what we strive to be. I'm the first one to admit that we still have a lot of work cut out ahead of us, but we are working towards that. And like Anton mentioned, to become that brand that whenever a social worker picks up the phone, whenever a CPS agent picks up the phone, or a truancy officer picks up the phone, we are a number that they could depend on.
Wonderful, wonderful. And yes, and that was kind of part two of what I was going to mention is really being able to use your awareness to really get out there in front of the masses because you see that you are a solid solution to the problem.
Mhm.
Being entrepreneurs, oftentimes people or individuals, and I've shared this with you guys before, individuals will see the lifestyle of certain entrepreneurs and just by default, I want the lifestyle. That's why I'm going to start in business. That's why I'm going to create this, create that. But you guys saw a problem that there is a deficiency in the ability for these organizations to handle the actual need. We
For
see a
sure.
way that we can actually come in and be an extra cog in the an extra rung on the ladder to really help the process be more efficient, serve more individuals. So you solve the problem, you figure out, okay, this is the unique value proposition that we bring to the table. Let's go out and push Texas Care. So I
Mhm.
love that because you're seeing a true problem in society and you're using your skills, your resources to be a part of that solution. Now,
Mhm.
keeping it on the lines of entrepreneurship in itself, lots of times people hear about something like this, and I'll kind of take it to my field in social work, and they wonder like, "Wow, this sounds incredible. I want to be able to do something similar." Now,
Mhm.
remember when I first got into my master's program, I saw this organization called Beats Rhyme in Life, and it was a gentleman by the name of uh, Tomas Alvarez. So Hispanic guy out in Oakland, California. And he built an organization to help a lot of the youth that were outside on the street corners, spitting raps, getting into beef, fighting, shooting each other up. He brought them into a controlled environment, allowed them to do their freestyles, all the same things that we're doing on the street corner. He built a wonderful organization, got sponsorships, was able to help these kids go through, programming to get constructive criticism types of
Mhm.
training, behavior or management types of training. The concerts that they put on was able to help fund that training. So it was a social entrepreneurship model. And I was thinking, I was doing research and I was trying to figure out how can I do something similar to that with him being way out in Houston. Well, I mean, you guys are in Houston. Him being way out in Oakland, who can I connect with to be able to do something like that? So just kind of speaking from the
Yeah.
entrepreneur
Well,
perspective, and we'll go back to the
yeah.
the actual work that is being done. I know me myself, when I see what you guys are doing in Texas, I wonder how could someone, and this is for a lot of my viewers who may be outside of the state of Texas, if they saw benefit in what you guys currently have going on, what are some avenues that they could actually either get involved or what are you guys, what do you guys have in the works to kind of spread this so that more
Mhm.
people outside of Texas can get involved?
Well, Brian, to answer that question, we are identifying other states that can potentially work with our business model. However, right now, when there's such a need here in the state, where 97 or 90%, 8% of our counties are experiencing mental health crisis, right? We do, and Texas is a very big and populous state, right? So what we want to make sure is that before we start tackling other states. Although we are identifying other states where our business model and our program will work, before we try to tackle that, we want to make sure that we get a good grasp on building up the home base first. And definitely don't want to spread our resources out too thin when there's so much help that is needed here at home. One of the things that for the viewers that are outside of Texas, there are many, many different type of programs. One of the things that we are actively doing is partnering up with other organizations that are that have a very similar vision on helping youths. Right, like I mentioned many times before, especially in the very low income, and unfortunately, in the black and brown communities, a lot of times the right influence in these kids' lives can make the difference between going to college or going to jail. Right. We work with Justin Smith. We're starting a partnership with him. He runs an organization which helps inner city youths, especially with talents in sports. Now, you know, one of the things that he mentioned is that there is so much talent in these inner city youth that unfortunately, a lot of times they're not realized. And they're in. We all heard of those stories where you have a prodigy sports child, right? But a 15-minute lapse in judgment due to peer pressure or whatever, they get a record, and next thing you know, their entire football career or basketball career that could have been is completely shattered because they got a record. These are the type of influences that we are trying to provide. Not only that, we're not just about mental health. Another thing that we work on is targeted case management, where not only are we working with the individual and the child, but we're also working with the family to change that environment. Because at the end of the day, like Anton mentioned, right, you could take the child out and put them in a clinical setting, right, where the child is probably, by default, going to try to tell the adult everything that they want to hear, right? And then you take them, out of this clinical setting and put them right back into the crack house, and you probably accomplish almost nothing. So the program that we try and we strive to work with is not only are we working with these kids in their own environment, in their own community, but we're trying to influence that environment that they're in. We identify through targeted case management, does this family have any food insecurities, right? A child is not going to concentrate in school if he's go to bed hungry every single day, right? Are they facing any rent insecurities, right? A simple Google search will let you know that in Houston alone, that's 84,000 households that are facing eviction, right? Approximately, 10% of the renting population. There are resources where, we provide relief for these type of situations. But for the vast majority of the people, unfortunately, they don't know these resources exist, or even if they do, they have zero idea how to get to those resources. And that's why, what makes us so passionate about this is that, hey, if we can make and turn a profit by doing God's work, well, you know what? That is a win-win scenario for us.
Absolutely. I was working on my doctorate at LSU back in 2017, 2018, 2018, if I'm not mistaken. I read this article called Doing Well While Doing Good, or Earning Well While Doing Good. And it really stood out to me because so many people, when they think of these helping professionals, they
Mhm.
look at it negatively when you are generating a lot of money. And
Sure.
if you know how to do well while generating a lot of money, as you mentioned, that can be a win-win. It's kind of like the whole notion where people say money is the root of all evil. Well, no, money just really exposes who someone really is. It allows
Mhm.
them to operate at a higher capacity and what their character already is. So I love what you mentioned there as far as being able to do so much good while turning a profit is something that in our helping professions we really need to kind of change the way that we view things. So another question for you in that area, or get you to kind of elaborate a little more in that area
Mhm.
before I got a specific question for Anton. So when it comes to your skill set, your background,
Mhm.
um, Andrew, what got you to the point where, or actually give me this, give me some of the skills and the achievements from your background prior to
Sure.
Texas Care that you felt really brings a certain qualification to the table to where you can kind of help the organization, specifically at the capacity of a CEO, help the
Mhm.
organization do and fulfill what the mission and vision is, as
Mhm.
opposed to or in alignment with what you've done in the past.
Right. Well, in the past, we started a healthy food company that, in very short order, became a nationwide brand within 5 years. We had over 5,000 retail locations that carried our product across 38 states. And that started off as smaller than mom and pop operations, where I was the cook, I was the delivery person, I was the package person, and with me be, I was the bill collector, right?
Wow.
And then that moved on into developing a company where basically we did everything that I did for my own company, but for everybody else. Why that story is relevant is that for the better part of 2 decades, we are what we did was building brands. Now, as you know, Brian, whether it's sales, building brands, managing a managing a staff, those skill sets doesn't change industry to industry. Now, you may be selling a different product, whether it's mental health, whether it's selling clinics, or whether it's selling food. The skill set of those things does not change. The pitch may be a little bit different. You just got to learn a new product. And one of the things that I noticed in the mental health field, especially on the social work side of things, and you're very familiar with this, nobody gets an advanced degree in social work because they expect to make a lot of money, right? This field on its own attracts a lot of social justice warriors that really, really want to help the community. But unfortunately, a lot of times, in the lieu of wanting to help the community, they give away so much things for free, right?
Mm-hmm.
And you're no stranger to that. Unfortunately, you can't help a lot of people if you can't turn the lights on. Right. You can't help a lot of people if bill collectors are trying to shut you down because you haven't paid rent, because you gave away so much of your things for free. Right. One of the things my mentor did tell me, and it has always stuck with me, is that whenever an airplane gets into trouble, right, in the air, what do they first tell you? When the oxygen mask drops, make sure to put your own mask on before you start helping others. Because one of the things that he mentioned, and this thing has stuck with me my entire life, is that the best way to help unfortunate and poor people is to make sure that you don't become one yourself.
Mm. That
Mhm.
is a great answer. Man, I could go so deep into just that response in and of itself. Uh, but I kind of want to pose a similar question to Anton. Now, Anton, I being in the social work space, there's oftentimes I'll put some sort of post up on social media, and people will, refer like, "Well, I thought you were a social worker. How can you be doing that? Like, how do you fit into that category?" So when it comes to Texas Care, kind of give the audience what is at your specific capacity that you serve, what does a day to day look like for you? Because not everyone does all things for an organization that they work for, as Andrew just kind of shared with us. But for you specifically, Anton, what does the day in the life working with Texas Care look like for you?
Yeah, as far as working with Texas Care, as a franchise owner, or as just being in the trenches, starting my own business, that kind of thing.
Mm-hmm.
Yeah. So I think the one thing that I've learned is you surround yourself with, quality people that are smarter than you. I've learned over the last, 4 years that, starting the business, getting the business set up correctly, making sure that people understand that, you have to get funding for business and credit. And, so I've learned a lot about getting a business started over the last 4 years, and even before that, actually. But the day in the life of me is really, connecting with my admin, building out systems, a lot of the stuff that we do in the background as far as the SOPs, the standard operating procedures, not only for all of the different things that we're doing with, website design, getting the admins hired, getting the QMHPs hired, learning all of the different variables when it comes to, the different insurances, the different things that the QMHPs need to go through in order to get hired. A lot of it, there's so much. I've learned that when I got into this, I just kind of got into it, ready, excited. But really, I was able to kind of surround myself, like I said, with good people that were able to kind of come together to kind of build this out together as a team, including Andrew, including a lot of people at corporate that we work with. So really, it's just going through the checklist of stuff. It's different every day. Every day we come up with different things that we need to do, whether it be hiring or working with other franchise owners to help them get going. We have a really good support system as far as getting going, and I'm kind of that support system, thinking outside the box. We ended up when we got our office, we ended up partnering with the church. So we ended up getting a great relationship there. It's really just my bartending skills from the last 30 years have really helped me being able to create relationships and understand people and be able to create those relationships and connections to make this happen for us. Because I think the main thing is if you don't have those relationships and those connections, it's hard. It's a lot harder to get things done. And if you don't know how to talk to people, if you don't know how to, get along with people, you need to be able to do that in order to kind of make things go forward. And I think I've learned a lot over the last 30 years as a bartender to be able to make this a success for us. But, thinking outside the box, strategizing, really just, it's a number of different things. I think that by the time I got into this and have the people around me, for example, our admin, Asif and William, they're very, very organized, and they've taught me how to be organized. So I'm kind of like the all over the place guy, but, we have to have this process in place. We need to have the systems in place in order to move forward. And I think I've learned a lot over since I've got involved with Texas Care on, wow, this is a lot of stuff. But if you put it into an organizational, bucket to make it kind of flow, everything is going great. And it's just a matter of just organizing it and putting it into action, really. I hope that answered the
I love
question.
it. Yeah, definitely. And kind of putting a bow on that part, something that I got from both of you guys, where the skills that you bring to the table are transferable skills. And I don't know if I share this with you guys or with someone else, but I look all the way back to when I worked at McDonald's. When you work at McDonald's, specifically when you work in the kitchen, you have to work with a sense of urgency and with high detail to or high attention to detail. Now, a sense of urgency and high attention to detail that transfers into almost anything that you do. So for professionals that may not see themselves necessarily having a career in this specific space, look at the skills that you bring to the table and how you can be one of the individuals on the team of professionals that's that extra piece of the puzzle that makes the whole picture come together. And as Andrew was sharing, specifically for my social work people, we have to understand that if we're the same people standing in the food stamp, the government assistance line, as those who we're looking to serve, we're probably not going to be able to serve them as efficiently as we desire. So,
Mhm.
understanding specifically, surround yourself with individuals that have the areas of expertise that complement what you have to offer, but make sure you don't only partner up with other people who are struggling. You partner
Sure.
with people who can bring something to the table to help pull you up a little bit, knowing that you have something that they don't necessarily offer. But when
Right.
you come together, you really allow the space to thrive.
Well,
And
Brian,
yeah,
I may
definitely.
add a little bit to that. So one of the great things about what we do here at Texas Care, and this is not something that I implemented. The founders actually help us implement this together, is that it allow us to be able to bring on very passionate people that love working with children, right? Unfortunately, in our field, especially in the social work space, a lot of it is either run by government agencies or is run by individuals who happen to do this on the side, or
Yeah.
an LPC or a licensed professional social worker that is trying to do everything on their own, right? As the business aspect of things is very, very different than
Mhm.
uh, the social work aspect of things. So what we do is we bring in a structure where we allow the people with the strongest skill set in that particular field to focus on just that. So whenever you work with us as a social worker, or whether you work with us as a licensed professional counselor or a qualified mental health professional, you get to do what you're passionate about, and not having to worry, hey, how do I input this into payroll? How do I worry about the technology of getting this turned on or getting that turned on, right? We have other people to worry about that. One of the
Exactly.
things why Medicaid is one of the best programs out there. Unfortunately, a lot of organizations don't want to work with Medicaid, is because Medicaid is not a simple process to work with, right? And that is why, as a licensed professional counselor, I just went to school for 15 years. Now I finally got this license. Am I going to go work with somebody that I could start immediately? Or, hey, I could throw my program into this government Medicaid field and wait 12 months before I could get an accreditation. And by the way, work more and make less, right? what we bring from Texas Care is a structure where we have people that will help deal with all of the nuances and all of the I's that need to be dotted and the T's that need to be crossed with the Medicaid side of things. So you, as a licensed professional counselor or even investor, don't have to worry about that. And I think that is the value proposition that we bring. And with that, we're able to expand very, very quickly. And we're very, very proud to announce that we are the fastest mental health franchise, or fastest growing mental health franchise in the entire country. And, it's due to the fact that we're bringing in all of these processes in place where, the most passionate people could focus on what they're most passionate about.
I love it. I love it. I love it. And we'll get ready to kind of land a plane on that point, and
Mhm.
I'll wrap it up with this. We have to always understand that we're not the only one that sees the problem that we see, but we're the only one that can bring to the table exactly what we can bring to the table. I do a
Sure.
lot of entrepreneurship development coaching, and we always go through, when I take them through my full training, your your management and organizational structure. You can be the CEO, but you're not going to be able to operate at full capacity as the actual clinical, person that's seeing people if you're having to do all the CEO, all the CFO, all the marketing. If you're having to wear
Mhm.
all of those hats, you're not going to be able to operate as optimally, whereas Texas Care allows you to operate in the area that you're specialized in.
Mhm.
As a professional in this space myself, it took me a long time to be able to articulate to those in the social work space the fact that you can utilize capital, you can utilize some of these profit generating models to do well, to do good in the community. And one of the things that I had to I did a little research on, and figured out, okay, this is how you can put this type of organization, a social entrepreneurship venture together, and not allow profit to overshadow the purpose. Is having
Oh, for
a
sure. For
committee or a specific department within your organization that focuses on, okay, X percentage goes to our stakeholders, and we pour this amount over here back into our programming to keep the transparency there, because that's one of the things that people in the social work space frown upon. Okay, you're coming in here, you're not a 501c, you're not a nonprofit
Mhm.
organization, like
Mhm.
you probably are going to be up to some shady business. So kind of cap us off with what your conversation is, Andrew, and then yourself as well, Anton. When you maybe get pushed back on, you're out here trying to help people, but you're turning a profit also. Kind of give me, what your conversation is in that space.
For sure. So, at the end of the day, there's nothing wrong with turning a profit and making sure that your organization is healthy. A lot of the best organizations that have done most for society are not nonprofit organizations. And to say this, a lot of nonprofit organization doesn't mean that the CEO doesn't get a golden parachute package where they make millions of dollars either.
True.
So one of the things is that we will never be shamed about being able to turn a profit. What we want to do is marry, the people that want to invest and allow us to be able to do the work that we do, right? Because at the end of the day, if like I mentioned, very, very hard to help communities if you can't keep your own lights on, right? So having a healthy organization is first and foremost, but at the end of the day, we do foster a culture. And this is the most important aspect of things. And we tell all of our investors, we tell all of our staff, and we tell all of our principals. If you take care of the children, right? If that is your main focus, don't worry about the money. It will come.
I love it. That point right there is all people need to know, need to internalize, need to embrace, and everything else will take care of you. Same question to you, Anton. Like, what is the conversation that you have with people, specifically those maybe in?
Brian, I do apologize, but I have 3 minutes before my next one.
Yes,
So I
definitely,
do have to hop off. But thank you so much for the opportunity
for
for me to
sure.
be welcome onto your platform, and I look forward to working with you and collaborate with you a lot more in the future.
Definitely, we'll be doing this again. Thank you so much, Andrew. We'll definitely be in touch. You take care now,
Thank you, appreciate it. Okay.
sir. All right,
Yeah,
we'll get ready. We'll close off with you here, uh,
yeah.
Anton. But yeah, just take us home on that.
Yeah, you know, when I first got into this, obviously you see the P&Ls, you see the money you can make, but in the grand scheme of things, you know, I've been in a lot of different types of businesses, but when I got into this, you know, and especially over the last couple of months when we've started to get to the point where we're going to open, you know, I get excited about the fact that we're going to help kids. And when I think of my kids and I want to make them proud of me for what I do, and I think that's what really drives me to do this business. You know, I had a brother-in-law that kind of said that to me. He's like, "Oh, you're just making money off kids." I'm like, I mean, yeah, that's true, but at the same point, it feels good. This feels better than any other business that I've been a part of. It feels good to know that, you know, 10 years down the line, my kids are going to be proud of me on the things that I've accomplished and the number of people that I've been able to help. And, you know, being able to have in my mind the fact that maybe I am making good money, but the fact that I'm helping people along the way is the most important part. Especially seeing the struggles that people are having these days, it's really tough to see. And if I can be a part of helping, you know, just one child out there to make a difference, to stop a school shooting, to, you know, help that kid get to college, you know, keep them out of jail. I think that's the most important part for me is that I just feel excited. I feel more invigorated when I wake up in the morning, more than I ever have in any other business.
I love it, man, and we'll end it there. You can have this big plot of money over here and say,
Mhm.
okay, I want to grow this money. I want to use this to generate more money. Let me throw it into this casino over here.
Yeah.
This will turn me a huge profit.
Yeah.
Or you can put it into helping kids. Like
Yeah.
this seems a lot more honorable to me. So why would anybody frown upon that? So
Yeah. Yeah.
I
Well, yeah.
appreciate. Now go ahead.
No, I appreciate you too, man. It's been a pleasure to get to know you over the last, 6 months or so, and under getting to know you and your passion, and you know, you're a great guy, and I always appreciate our conversations and the dialogue that we have. I appreciate you having us on.
Definitely, man. My pleasure. And I'll I'll put you backstage really quick.
Yeah,
I
I,
know
I
you have
actually have
to.
to hop on to another meeting with a applicant, so I apologize.
Definitely.
Is that okay?
No, you're good. You're
All
good.
right.
I'm
Yeah.
gonna close us out. Thank you so much.
Yeah,
We're definitely
man.
gonna
All
have an
right.
encore,
Thanks,
man.
everybody. I appreciate
Take
you
it easy.
all. Thanks for watching. All right. Thanks.
All right, so see, that's these are the type of individuals that I like to work with. Individuals that are out here doing things. They're not just sitting around waiting. I'm twiddling my fingers. Let's go and hang out with Brian because we have nothing else to do. These guys are out here in a community making impact. So, if you want to learn more about Texas Care, how you can potentially get involved, how you can potentially become a franchise owner, yes, a franchise owner of a mental health, a behavioral health, an organization that's out here making a difference in the community, not a franchise owner of just some company that wants to sell you a product and turn a profit. So definitely reach out to myself. I can get you in contact with these individuals. I'm still searching for the best manner by which I can engage with and work with these individuals. So definitely don't hesitate to reach out. We will be back. I was looking to have a couple more episodes this week, but as it pertains to legacy dialogues, we'll be back not next week, but the week after that. I'll probably have about 3 or 4 people on that week because I want to bring some more professionals to you to help you understand, to see, to have access to some of the things that could potentially help you start to create the legacy that you desire to leave behind. Off that note, guys, much love. We'll see you next time. Y'all take care.